This is always a tough question because the knee replacement surgery is really for the quality of someone's life. While ultimately it's a pain relieving procedure, what we're really most interested in doing is restoring people back to function. And the way I think about it, and the way I like to think about it, I like to think of in terms of nuisance and disability. And if people have pain from arthritis, but they're still able to do everything they want to do, but it irritates them, I usually tell people to continue to live with it. But once the pain becomes to the point where it's starting to interfere with people on a daily basis, that is, disabling them from their normal activity, even including walking, going up steps, those kind of things, getting in and out of a car, putting your shoes and socks on and off, being able to maintain your health and physical activity, even sports, the things that are important to the quality of a person's life. Once the arthritis starts disabling people from that, that's when I would consider knee replacement. So while I consider 30 minutes of walking every day to be necessary for people's health, not everybody does that. So some people that wouldn't be a reason. On the other hand, not being able to play golf or tennis or pickleball could be a reason for a lot of people that are otherwise active. And so it's really an individual choice. And the choice that I always encourage is one based on something that we can measure, which is the ability or inability to do something, i.e., I can't walk 30 minutes, I can't play pickleball. And the surgery itself has to be able to help those things. So that's how I view it. And it is for pain, that's for sure, but there's lots of treatments for pain that don't improve people's functional ability. And so it really, for me, the operation is about improving the quality of someone's life and their functional ability.